A lot of these patients we're sending home right now. We're in disaster mode, so we have very strict criteria about who's actually being admitted. And so there's a lot of reassurance that's being provided to patients because I understand what they're going through. I understand why they're scared. You know, I've been through those symptoms and I'm on the other side, and it will get better, but it's just a very, very long road. My name is Trudi Cloyd, and I am 35 years old, and I am one of the emergency medicine physicians at New York Presbyterian and Columbia Medical Center. Well, I actually was one of the confirmed as tested positive, and I've made it through, and now I'm back to work. A lot changed in those 12 days because I isolated myself inside of our apartment. Fortunately, we had another bedroom, so my wife moved in with my daughter. And I was really strict on trying to prevent them becoming sick. Somewhere between the fevers, I realized I really had to send them away, that it wasn't going to be safe. New York City is a challenging place to keep loved ones safe in right now, just because there is so much sustained community transmission. And it was really tough because I didn't know where to send them. When you think about it, my wife and my daughter were like nuclear material. It was like, where am I going to send them? No one wants them. The likelihood that they're going to become symptomatic and be infected was really high. And you can't send them to a hotel, and you can't send them to a friend's house. It was really tough. And then about 3 days after I was isolated, my daughter started walking, and I mean, we must have been waiting for like 3 months every day for her to start walking. You know, it was like, when is she gonna let go of that last finger? And then that day, 3 days after being isolated, she stood up and walked out of the room like she always could have. And my wife called me, and it just broke my heart to not be there to see it. And everyone tells you, oh, there's so many milestones in life, and you know, you'll get to see so many other ones of them, but I'd been so looking forward for that moment. That's my Dory. I would say the really touching part of this whole thing has been the outpouring of support that a lot of us have felt. I mean, I got so many notes under my door from neighbors. I got people asking what prescriptions they could go pick up for me. There's actually this older Italian woman who loves to bring me lunch, like a home-cooked lunch every day at like 12:30. But she's still insistent that, you know, I'm always in the hospital and I'm always working, so she has to keep dropping food by. And it was the type of thing where New York comes up and totally surprises you. When real challenges come, then people really come together.